Hi everybody, this is Dr. Vila with Revive Upper Cervical, and today we're talking about concussions and pinched nerves. A lot of times when you have a diagnosis like concussion or Post Concussion Syndrome, it's not talked about the same way as when you hear about someone having a pinched nerve. So let me explain that, because it might actually offer a solution to a friend or family member that you might know that's suffering with post-concussion symptoms, people who have had a concussion in the past that are still dealing with a lot of visual problems, balance issues, headaches, mood disorders, things like that. This might be why they just haven't gotten better yet. So let's talk about this for a second. When somebody says, I have a pinched nerve in my neck or a pinched nerve in my back, usually they're talking about a situation where one of the bones of the neck or back have gotten twisted, squeezing on the discs, stretching the muscles, irritating the nerves, and causing symptoms associated with a bad neck or a bad back or a pinched nerve. And those symptoms are usually neck pain or pinched nerve pain, meaning searing, pinpoint pain, or maybe carpal tunnel syndrome, numbness and tingling, or weakness in the hands, or pain down the back, sciatic pain. Usually that's what we think about when we think about having a pinched nerve or a bad back or a crooked neck. We think of those things. But here's the idea that I want to show you. If you look at all the nerves of the spine and the spinal cord, they go through those bones, not only from the top down, but also, and here's the key, from the bottom up, right? So if I pinch a nerve that's going from the brain out to the body, and I disturb that communication signaling, that communication pathway, we think of it downstream. But what about the effects of the misalignment above the point of misalignment, right? Now, my schematic, it's not as simple as this graph, as this schematic may show, but the point is, clinical evidence has shown that when people have, and actually bona fide research has shown that when people have a concussion and they have these symptoms, blurred vision, headache, dizziness, vertigo, mood swings, anxiety, depression, chronic fatigue syndrome, things like that, ringing in the ears, when people have a concussion, they have these symptoms. But guess what? When people have whiplash injuries, car accidents, athletic injuries that cause a whiplash effect to the neck, guess what? They also have these symptoms. So is it the concussion that's causing the residual symptoms that aren't going away? Or is it the pinched nerves? Is it the whiplash at the base of the skull, agitating the neurology going up to the brain? Just like agitated neurology and messages going down from the brain causes symptoms down in the lower part of the body, irritated messages going up into the brain, into the lobes of the brain, can cause a dysfunction there, an agitation, an irritation, just like in the hands, just like in the legs, and just like in the feet. So here's my recommendation to you. If you know someone or you yourself have had a bad whiplash injury, or a bad concussion, either one, but if you've had a concussion and you've gone through the standard protocols and procedures, the vestibular therapy, the vision therapy, you've been to the concussion center and that sort of thing, if it's not clearing up, if the symptoms are not going away, even if they are, you should have the cervical spine, the neck looked at. But especially if they're not clearing up, I want you to open up the possibility that it might be your neck. That might be the reason those concussion symptoms have not cleared up yet. And I would highly recommend seeing a very specific type of provider to look in to see if there's an instability in the spinal column causing an irritation to the neurology in that area. In our profession, we call that a subluxation, a misalignment of the spine, decreasing the communication between the brain and the body. And in your neck, your upper neck, is the upper cervical subluxation, some of the most damaging that we know of. So if you need a referral, or if you have a friend that needs a referral, please share this video, ask questions, comment in the comment section below, and we'll do everything we can to find you the help that you need. So thanks so much for watching, and we'll see you next time. Bye now.